Do you have stomach aches? Today you will learn about 3 types of stomach pain that you shouldn't ignore. That painful sensation in the upper abdomen is well known for everybody. There are many causes for this pain, and according to an Italian saying, stomach ache is, simply put, no happiness. It's a fact that stomach aches are common symptoms, especially during current times. The pain is usually followed by vomiting, nausea, burning sensation in the stomach, and gas. Gastritis is one of the most frequent causes of stomach aches. It causes flatulence, gas, burping, general malaise, burning sensation, and abdominal discomfort. Stomach ache caused by gastritis is usually related to the bacteria H. pylori, which hinders digestion. Reflux is another common situation that causes pain in the stomach. Besides a heavy sensation and burning in the stomach, it can also be accompanied by burps and dry coughing after meals. Reflux symptoms usually appear after a meal and can leave a bitter taste in your mouth. In this case, your diet should be poor in fats, alcohol, and industrialized food. Eat at least 3 hours before going to bed to prevent food from returning to your mouth. Stomach ulcers can be caused by the presence of bacteria H. pylori, or as a consequence of a diet rich in fats, processed foods, and acidic foods. In this case, the person will show symptoms such as stomach pain, nausea, vomiting, and abdominal discomfort. Changes in diet are key for seeing improved results faster, but you will need to go to a doctor to receive a diagnosis and check if your stomach ache is caused by an ulcer. If an ulcer is identified, you will need to take medication according to your doctor's advice to prevent the stomach's acid from hurting even more the mucosa. In some cases, your doctor may prescribe analgesics to control the pain. Your diet can help with all these pains and stomach issues. We even taught you how to make potato juice. Watch the suggested video to learn the recipe. To treat stomach aches, maintain a light diet with lots of salads, fruits, and natural juices, like watermelon, melon, or papaya. Avoid fatty foods and alcohol. Keep away from coffee, mate tea, chocolate, soda, excessive salt, and canned or processed food.